Our world has changed.
Doctor has the other camcorder, I don't know where it is. I know I don't.
I think it's in my office, I believe.
It's squirreled away where it's safe.
Smart. You heard about Rose?
She may be helping people get well.
She answered email earlier. I know she's alive.
I saw her earlier today. Tuesday's her day she doesn't see patients in her office. She does nursing home visits, all that stuff. I did see her this morning. Well, it's 5:31. You want to start?
Sure.
I guess, I feel sure that y'all can catch Dr. Burroughs up if she has any questions, right?
We will try. Go ahead, Brian.
Oh, sorry. There's an agenda if you'd like one.
Okay, it's 5:32. We'll call this meeting to order to show that John Parker and Paul Harper are in attendance along with Ray Reynolds and Betsy Whitsitt.
Did you say Betsy Whitsitt?
Becky Fitz. I'm reading. That's what I get for
Thanks,
for reading.
Ronald.
You know, I was reading Freudian slips earlier today.
That's right. Yeah, there you go. There you go.
The lower part of my bifocals are a 2.0. Would you like to
I
borrow?
think I did.
I was looking at the last name and saying the first name. I don't have
That's
to.
right.
Yeah, Whitsitt's a little hard to,
Yeah.
yeah. That's okay, I'm just
That's
teasing.
funny.
All right. The minutes from the are they attached here?
Yeah, right behind.
I think they're on top.
Oh, they
Top
all,
sheet.
yeah, you know what, I'm sorry, still haven't got the whole.
I don't have the agenda, but we.
Yeah, the minutes are there. Yeah.
Did
Okay.
y'all need a copy of the agenda? I brought
No.
one for myself, but I didn't see
I've
you bring
got
one.
one in my phone.
I've got
Do you want me to go make a copy?
No, I'm
Okay,
okay.
all right.
Okay. When you're ready, we'll entertain a motion to approve the minutes from April 28th.
Have you looked at the minutes? Do you
Doesn't
see
take
anything
long.
that looks abnormal?
That looks right to me. That looks like exactly what I
Okay.
have.
Is that a motion?
I'll move we approve
Got a
it.
motion? And a second. Okay. All in favor, aye?
Aye.
Okay, first item on the agenda is to review the monthly and year-to-date financials for the month of April.
Okay. The PowerPoint's up if you want to look at that also. The actual admissions for April was 43 with a budget of 65. Prior month, we had 55, so our admissions were down. Gross revenue, $3,728,289.
Hospital admissions is an interesting thing to talk about just a little bit because
Yes, because it's
It
never
had-
hitting.
it's been, you know, we, I guess 3 years ago, we budgeted 75 admissions per month, and we didn't hit it.
Right.
So then we came down to 70, and we still didn't hit it. And I think this year we budgeted
65.
65, and we're still not hitting it. Now, yeah, you look at outpatient revenue is where it's all going. But I think it's just an indication of what's going on in healthcare. How much is moving away from inpatient to outpatient? And I don't really know where the bottom, and that's kind of interesting because
Yeah.
we have 2 additional providers.
Right.
You know, we had Dr. Vosick and Dr. Lawton, and
Well, so far during this fiscal year, have we even gotten there more than once?
I believe
think
one
once
time we had,
Yeah,
well,
we
we
can
should
look
be
at
able to look at
it.
it.
Mhm.
So it's not from lack of ability to be able to handle it.
No,
And it may not be, it may be that we're not waiting.
The very last couple pages, if you'll see the patient statistical report, the first block there is admissions. And you can see the totals for October, November, December, all the way through April. And you can see that we've only met it one time, that was in January.
Yeah, that's never over.
It's this page right. You want to see?
I don't remember exactly why November sucked so bad, but it did.
Oh, that was,
oh,
it was
yeah,
awful.
it's the lowest that we've had in
Was it
forever.
weather? Did we have our ice storm in November?
No, I
I think
don't
that's what
believe
the
so.
girls right there.
I don't believe so.
Oh, could be.
Really?
But anyway, it's just, I think the function
Here we are,
of.
agreeing without her.
You can answer the question first. We're just talking about why so much of the hospital revenue is moving from inpatient to outpatient, because
She snuck back out.
Oh,
and
I was just trying to get a copy of that.
Oh, I'm
Oh,
sorry.
here, have mine. Oh,
Wait, no, there's plenty, there's plenty.
Oh,
because you look at that, we're 43 admits for the month, but from a total revenue standpoint, and we were 200,000 over budget. But it's just not on the inpatient side anymore, it's all on the outpatient side.
Is it because y'all are keeping them so healthy, they don't have to lay down in the hospital?
It's expensive to put people in the hospital.
Well, Donna, do you know
I
how
would
to
be
make this a
suspicious.
slide where it's?
Well, and I talked with one of the doctors here recently,
Yeah, that
and
was
part of it is that we make it so difficult for doctors to admit patients. I mean, you've got to meet the criteria, and we make it difficult, or I
Not
guess,
us making it difficult, it's
Yeah.
insurance companies. making
Where do you
it
see it?
difficult.
But,
Slideshow.
you know, because if the patients don't meet the criteria, you don't get paid.
Yeah.
So,
So hopefully
Oh,
that means
here.
the admissions we are getting are completely appropriate and covered.
thank you.
We
Thank
get
you.
reimbursed for versus more that we might not.
Yeah, that was better.
we do have a swing bed patient on the floor. Our first swing bed patient we've had in a little while. Anyway, I just thought that's interesting to talk about just a bit.
It is, and we probably ought to pay attention to that when we start budgeting.
Absolutely. I mean, I don't know where the floor's at. I really, I don't know where the floor's at.
Guess at what we're going to be doing, and we might not see a floor. The floor may be dropping in front of us.
Yeah.
The next page shows the salaries for the hospital at $507,024 with a budget of $498,002. Benefits at $196,946 with a budget of $198,080. Our net revenue, $1,081,899 with a budget of $1,064,405. Our salaries as a percent of net revenue, we were at 47% with a benchmark of less than 47%. Our budget versus actual salaries, we were $9,022 over budget. And our ratio of salary and benefits to net revenue, we were at 65% with a benchmark of less than 65%.
Closer than last one.
It was close to that, yeah. Thank you. The next page shows some of our expenses. Supplies were down again, $176,964 with a budget of $203,200. Professional services, we were at $149,933 with a budget of $163,967. Repairs and maintenance, $26,482 with a budget of $28,012. Our indigent was down a little, it's $29,118 with a budget of $41,341. And our total expenses, $1,325,586 with a budget of $1,388,375. So all of our expenses, except for that salaries, was a little bit over, but everything else we were under.
Does that include what we've paid in other counties to take care of our indigents?
Yes, yes.
The pharmacy's the big number there, it always is. It's prescription drugs.
Do you know if there's less people asking for indigent assistance, or are we
Are we making
being
our
very
average?
particular about who we're accepting,
we're-
or?
We're pretty tight, I mean, in terms of who we qualify,
But we're following the state guidelines.
Well, follow state guidelines, yeah.
Our cash
I
collection.
haven't looked at, well, year to date, we're 51,000 under budget year to date, so even there, we're.
It's just a question as to whether it's because we're not providing care that people need, or if it's because there's less people that need care.
Right.
Less people, that's what, reflected this.
Okay.
Our cash.
being-
I'm
That's
sorry.
all right.
No,
No,
you're
you're
fine,
fine.
Charlotte.
You want me to leave this door open and close the other doors? I'm sorry.
Yeah, no, you're fine.
We'll take
Yeah,
care
I
of
was
it.
about to mention the cash collections. I thought that's why she was about to chime in.
Yes.
Being over the business department, business office. Cash collections were at 93%, with a benchmark of greater than 98%, and our days of cash on hand, 26 days with a benchmark of 45. That's-
So the 26 days,
Mhm.
Are we at the point now where we have bills we're not paying because we're waiting to pay them?
Yes.
We're behind on, yes.
Yes.
Yes. There's no way to sweeten that up, sorry.
We don't list what those are
Well, you know, since
and what the
The-
impact will be, like the tax situation from last year. There was a
Well,
penalty
the-
associated with that.
our payroll taxes are current, we've been keeping them current for a couple of months now, thank goodness. But of course, that's why we've depleted some of our cash, because that's where it's going. Some of our vendors, you know, we're getting calls, and we just, some of our vendors, we've been able to make arrangements. There's a couple of them that have wanted a lump sum payment, $29,000, $30,000 for something. We've been asking if we could do payments throughout the year, which so some of them have been letting us do that. But then others, yeah, we're a little bit behind, and they call us quite frequently.
Something I think you'll see next month, we're working on it right now, is a schedule of where we are with our payments for the programs that we're involved in.
Right.
Now, 11, 15, which means we use, there's no more dollars there, but there's also dollars that are expected from,
The district, are you talking
no,
about?
I'm talking about the 500,000 from the low volume, Medicare low volume.
Oh, yeah.
Medicare low volume. So you'll see that next month. We didn't have it for this meeting, because that's, you know, a significant amount of our cash crunch has to do with the fact that we're not being paid on a timely basis from the government programs.
Right.
And,
How much of our budget is government programs that
well,
can be delayed?
Quite a bit.
yeah, a lot, whenever you look
We
at
counted
that.
on a lot of payments for
Yeah.
things before we really knew we had them.
And some of this is probably based on, we were expecting more admins too, right?
No, I don't really think that's it at all, because
Most
our
everyone-
total revenue is above where we budgeted.
It is.
Yeah, so we're, you know, from a total revenue standpoint, we're in good shape, or, you know, we're above budget. Contractuals always get us, and our contractuals, and what happens to you on a contractual basis is whenever you move from inpatient revenue to outpatient revenue, you're picking up greater contractuals, because contractuals are greater on outpatient than they are on inpatient, as a percentage. So that's, you know, that has something to do with that, but you know, our 11-15 program, you know, the government's behind. You know, we've got a payment that's projected, but they've already reduced what we expected to get, and are delaying that till September. So, you know, they're a year behind.
Right.
They're a year behind in that. The Medicare low volume, you know, we think there's some dollars there, but we'll bring that to you next month. Because kind of what we're, just go ahead and tell you kind of what we're thinking about, is at some point in time, you know, we may have to take a short-term loan to be able to meet our expenses and repay that from government dollars when we get them. And we're trying to do that work for you. That's why we kind of give you a little look ahead as to what we're thinking on that.
Well, as long as we're talking about it, I would like to point out that if we had known just how low we were on money and having to set bills back, it might have been a lot easier to set a different tax rate last year.
Well, yeah, but y'all got real close to the
We only
rollback rate
Yeah,
last
we
year.
only had a little bit of room beyond what we did.
Yeah. I think, you know, just my opinion, you didn't ask, but I'll give it to you, but you know, I think where we made our mistake was on the initial tax rate.
Definitely.
Yeah, because we budgeted, what it was, 10 or 10 and a half cents. Whenever we had a 17-cent tax rate kind of approved, if we'd have done that, that would have given us a little bit of reserve. We could have then hopefully reduced the tax rate. But you know, that's hindsight, it doesn't matter, but now we are in a pickle because of the rollback rate.
And because we're losing so much of our federal funding.
We really put our federal
And I
funding.
think it even goes to counting on money for, as part of our income that we really didn't have
Yeah.
an idea of how much it was really going to be.
Yeah, because one of the programs that we lost after we prepared our budget was the UPO program, the program we had with Baylor, where they paid for our ER,
Radiologists.
yeah, radiologist, the
Senior care.
senior care psychologist or psychiatrist, the MRI, that's $350,000. That just went away. So, it's functional what's going on, not with us, but with all of healthcare, and it's particularly a problem for smaller hospitals. Just don't, that have little to no reserves, so. Anyway, you're gonna be hearing more and more from us about,
That's what the finance committee needs to hear.
Yeah, that's right, so.
That's true.
So, anyway, that's, it's not, I mean, from a, for smaller hospitals, it's a tough road. It's a tough road to hope that you're depending on, and we're not critical access. We're critical access, it's cost reimbursement, but we're not critical access because of our proximity to Lake Render. Critical access, you get paid on cost reimbursement. It's like the old Medicare days where whatever you spend, you get reimbursed for. And that's primarily a program for rural hospitals that are low volume. I didn't take over your meeting.
No, you're fine.
But it's interesting to talk about because it's something that we talk about, nearly daily, certainly weekly.
Sure.
The next page shows our collections for the hospital of, once again, over $1 million, so $1,003,042. Our net revenue was $1,080,302.
But that 72 is probably actually things that are simply not collected, not things that are written down.
I'm sorry, we're on the what?
The 72,000 we're missing.
No, we collected more than that.
72,000.
Actually, we collected $1.3 million, and we're supposed to.
We have $1,080,000.
$1.080.
Yeah.
Oh,
I see what you're subtracting there. I see what you're saying. Well, these collections are for, this net revenue was for, the net revenue in April. The collections are from prior months.
Okay.
Not just April.
yeah, that's just an indicator that we look at.
Mm-hmm. And usually we're pretty excited if it's over $1 billion, the business office is doing a really good job on collections, then they've held really steady there.
That's another interesting thing to talk about is that, it's one thing we talked about last week, is that we've been in $1 million collections forever. I mean, that's where we've been. I mean, that's just been flat.
Sure.
And that's a function of our revenue. Our revenue, total revenue, has been flat for the last several years. And that's, again, that's a function of the business that we're in. But you would think, because you would think that over a period of time that the collection percentage or the amount of collections would move up. But we collect a good percentage, but it's staying right at $1 million. That's still our benchmark, is $1 million a month on collections.
The next page shows the cash flow for the hospital, April being the first month of the third quarter. Wait, is that right? Oh, yes, that is right. That took me for a minute. Collections and other revenue for April, $1,385,507. Expenses minus depreciation of $1,254,468, leaving us with a cash surplus of $131,039. Bringing the year-to-date collections and other revenue $9,681,054. Expenses minus depreciation of $8,775,919, and a cash surplus of $905,135. But then we turn the page. But then we turn the page and there's consolidated. So the hospital and clinic together for April, collections and other revenue of $1,617,668. Expenses minus depreciation of $1,622,370, leaving a cash deficit of $4,702 for April. And the year-to-date, $11,225,102 in collections and other revenue. Expenses minus depreciation of $11,337,484, and a cash deficit of $112,382. That's it for the PowerPoint, but the next couple of pages are the financials, starting with the hospital.
Yeah, let's look at that a little bit, if you don't mind. Look down at the bottom, because that's kind of what we've been talking about on the other income. And the way we do the district tax revenue is we take the number divided by 12, and so we accrue that so it matches up, even though we receive it. But if you look, if you look at 1115, I mean we're 88,000 below what we budgeted for that. Then if you look, the big one is the UPL, what I was talking about. The UPL, we're 350,000 below what we had budgeted for other income through the UPL program. And that program has just gone away. But, year to date, we're 407,000 below what we budgeted for other income.
I think what's interesting is year-to-date, if you're looking at the revenue, inpatient is under budget by $500,000, but it was made up for in outpatient, just like Ray was saying, made up for more, $586,000. And of course, senior care is still doing a great job out there.
We've got a favorable, year-to-date favorable revenue budget of 221,000, and then when you look at that, there's also a favorable expense budget of 444,000. I mean, those are both really favorable numbers, but then the contractual is a biggie. There's an $850,000 unfavorable variance in year-to-date contractuals. Most of that coming from the Medicare and Medicaid side. Some from bad debt, but most of it Medicare and Medicaid. And then the balance of that coming from the other income. But even with all that on the hospital side, we still have a favorable bottom line.
Does the Medicare and Medicaid discount depend on something we do, some volume we have, some?
No, on the inpatient side, whenever you admit a patient, whatever that diagnosis is determines what you're going to get paid. And if you get a patient that stays, really more than 3 days, that's kind of the cutoff, stays more than 3 days, you're losing money on that patient. But that's the insurance companies. But what's happening on the insurance companies is that insurance companies are now paying a percentage of Medicare. Back some years ago, you made your money on commercial insurance because that was they paid whatever their negotiated amount was. But now their contracts are being tied to Medicare, where they pay 125% of Medicare or some other percentage of Medicare. So for instance, last year, whenever we had the 2% reduction in Medicare payment, it also reduced what we get paid from the insurance companies because theirs is tied to what Medicare pays. It's one of the other things we talked about a little bit on the Medicaid side. So regardless of where you are politically, from a hospital standpoint, if Medicaid was expanded and more people came eligible for Medicaid, we get paid something in place of nothing because many of these patients now have no insurance. They qualify for Medicaid, but they have no insurance. That's kind of the dilemma. I mean, that's the hospital's position is that we like to see the state expand Medicaid, we participate in the government Medicaid program, but we don't get to make that decision.
Right, that's a.
No, but you get a letter.
We do, and we have, and our associations lobby for us and all that, but,
So most districts are pushing to get the Medicaid extension thing?
well, the hospital associations are, that Targe and.
So it's not just us, it's everybody?
It's everybody, it's the same deal.
Turn your bad debt into crappy payment, into less payment, but at least it's something.
Oh, little.
Yeah.
Yeah.
We've got a better electric rate now, so we can afford to take less if we have to. Less is better than none.
You have a question, Becky, on the agenda statement? Again, and we'll talk about this in a minute, but the departments have done a really good job on managing the expense side of it.
Yeah, they have. Behind the hospital, we have the 501A financials, the income statement, and balance sheet.
On the income statement for 518, there's a little bit of you know, it's not bad anyway, but there's a little bit of good news. Dr. Vossi, whenever he started practicing, we see Medicare patients, but we can't bill for those patients until he gets his Medicare number. But once he gets his number, we can go back and we can pick up all of the charges from the time that he started practicing, and that income is not accrued in here. So there's, you know, once he gets his Medicare number and we go back and bill, you'll see a month that has a pretty significant jump in. You maybe ask me how much that's going to be, and I don't know that with that.
So we aren't actually showing the revenue for what he's doing now.
That's
That's gonna show up in a couple months.
for Medicare, yes, sure will.
At least we assume it'll be fairly soon.
Well, we think it'll be this month, because it's, you know, we're waiting on, you know, it's been long enough, we're waiting on the Medicare number right now, expecting it, yeah, it is.
As long as the government's
And again, on the expense side, I mean, you know, very favorable numbers, you know, on the expense side of it.
I did want to point out on the 501A balance sheet, this looks a little strange. It looks like we're under on our cash, but that cash includes not just the bank accounts, it also includes the clearing accounts. So there's a kind of a timing issue. So where it says cash negative $31,996, that's not the bank balance. The bank balance was over $20,000, but it looks a little off there because the clearing accounts are included in that also. We have timing issues with Athena and so on, so I just want to point that out. It looks like we wrote a bunch of checks we couldn't cover. Not the case. And then behind that is the consolidated. The revenue for the year, if you look at the year-to-date revenue, total revenue, we're pretty much right there on the mark. And then the expenses, total expenses year-to-date, $670,000 under budget.
And I'll tell you this, when we did the budget, we thought that we had a pretty tight budget, we really did, in terms of the expense side. So I think a lot of what you're seeing here is the departments that are really working hard on that. I mean, they've cleaned out their inventories and all their, you know, supplies that people had squirreled away, so. They'll pay for it next year when we budget a lot tighter next year. We'll worry about that then, yeah.
I have them coming in or sending me emails if somebody got charged for a ream of paper that really belonged to somebody else. It's constant. And they are really, watching those expenses now.
We had a big fuss over use of coffee in the nurse's station.
Yes, oh my gosh.
A couple of weeks ago. The departments were coming in, taking their coffee.
Apparently we buy a bit of coffee for the patients, but so they didn't want, you know, employees using it, and the employees are getting, oh my gosh, it was craziness. Craziness.
It sounds like the kind of problems you want to have.
I guess so.
Yeah.
Most important thing to worry about.
If y'all want to move on to the complementation income statement, I was just going to point something out real quickly. I put some asterisks there beside the revenue lines and some of the salary and employee benefits. It's because as of April 1st, Virginia Barrett is now over at the con. She is underneath Dr. Carpenter. So all of her revenue, instead of hitting under Dr. Turk, will now be under Dr. Carpenter. So there's going to be, you'll see probably some changes here. But that also means that her salary, her employee benefits, all that will also be hitting on the pecan side.
Are we
This is that thing that Mike created that she took over, right?
That Michael,
Yeah, that she took over and
yes,
you're.
yes. Do y'all want to see
No,
this?
I like
Oh, okay.
I like knowing.
Now, is that her year-to-date salary that's in there? I guess it is.
No, not Virginia, it's just starting in April.
Okay, just to start, I got you now.
Right,
I got
right.
you.
Just while she's working.
Just what she's
Just,
working.
exactly.
Right, it's Maxwell, okay.
We haven't expanded over there yet, have we?
No,
We're
no,
still
they're
waiting for
still.
new construction.
No, and then just another thing to kind of make you aware of, we've interviewed a nurse practitioner who wants to do some part-time work. She's on the Tarleton staff and she lives in Pecan. She's wanting to do some part-time work and we're talking to her about doing maybe an extended, hours, out at Pecan.
That sounds
And
wonderful. if the
then maybe an
staff
evening
like-
here too, Dr. Vossi works every Monday evening late. And trying to get her to maybe take Tuesday evening, give us 2 extended hours, evenings here, and then Saturday coverage out at Pecan. So we don't have it finalized with it, but it's just something we're talking about.
It sounds like it'd be a very handy thing.
Yeah, and patients are there, I mean,
Yeah.
Dr. Vossick's been full every Monday night, and then on Saturday, we're seeing 15 patients or so, on Saturday morning out of Pecan.
Well, being a leper, I don't hear much from Pecan, but 2 of the people I did hear from, both of them said, yes, we need more people out there.
Yeah.
And I told them I thought we were working on that.
We are,
And she's
absolutely.
gonna fill in on vacation.
Huh?
And she's gonna fill in on vacation.
Yeah, vacation, yeah.
Wonderful.
Next, we have the OSA document. This shows the transfer between 501 and the hospital. And after that are the check registers. The first 4 pages are the hospital, and the following pages are for the 501A, if you want to look through those. And
This is on the board agenda, but I'll visit with you guys about it. We did contact our attorney about putting the check register on the website. He advised against it, strongly advised against it. He didn't think that was the proper thing to do, that, it was you guys' responsibility to review the detail. When you start putting the detail out there, you got issues with what you're paying for paying different vendors. He just strongly advised against it, putting it on the website.
But it's not illegal, because the county does it.
I didn't say, no, he did
The
not
city
say,
does it.
he did not say it's illegal, he said that he just advised against it.
I thought it was also like he was concerned about HIPAA as far as there will be patient
Yeah,
refunds and.
there's lots of, we'll bring you a copy of the memo or the email from him, but he just strongly advised against it.
And you said the first 4 or 5 pages are
The first 4 pages, and you'll see, say HOS at the very end at the very beginning over here, that means hospital. These are the hospital check registers, and then the
Oh,
2 behind it are the 501,
yes.
and they'll be marked with 501.
So any chance you can get like a reason over here what these checks are for? We can see who they're to and amounts and dates, but we don't have a clue what they're for.
Like a
Unless
description line.
it's for a person or something like that, right?
Well, this is
Actually,
straight out of, it's just a regular standard report out of CPSI, but I could certainly try to do that.
I can tell you something that might be easier.
Mhm.
Put the account number it's going into, and gives a list of accounts.
The account number it's going into.
Yes,
Being paid out,
check being paid out of,
whatever's being
Well-
charged for, whatever expensive, whatever
It still
expensive,
doesn't tell me what it's for.
Oh,
whatever expensive.
well, if you know what the expense is, then you can pretty well surmise, and that wouldn't take much extra work, because it's probably, whatever generates this knows what account it's going into.
Legal
Right.
Club of America for $180.
Who's that?
That's
legal
an
club is
employee
a payroll
deduction.
deduction.
Yeah.
Mhm.
That's an employee benefit that the employees pay.
But we don't know that.
No, that's
No,
one
but we
thing.
have a lot of
We
people
can
that
ask.
are monitoring this, in the
Yes.
facility to keep track of that stuff.
And our auditors audit it too, like at the end of the year to make sure it matches up. CHC monitor, they do an audit annually on their benefits too.
I notice we occasionally pay something to the Marks Foundation. Is it still being active?
Yes,
Mhm.
yes, that's a payment, there's employees that participate
Oh,
on
yeah.
employee deduction, so it's what's taken out of employees and then we put into the
It's their donation.
Gary Marks account, the Roger Marks account.
Do we have anybody around here that's taking care of the foundation, or is Gary doing it all from his house, or?
Well, I guess we are, I mean, I talked to Gary before I make like for instance, we gave the scholarships, I asked him to come up and participate with us in the selection process for that. But there's not a whole lot going on, and it's one of the things that Lisa's working on, is trying to get the Marks Foundation sort of revitalized. But they've got a pretty good bank account right now. But I think that's one of the opportunities for us. Sir?
They can buy us stuff.
Well, we talked about needing to fix some equipment the other day, and that was one of our options, was to go to the Marks Foundation to get it funded.
Or at least revenue sharing, they pay half, we pay half, or something like that. Yes, by all means,
Yeah,
it'd be sweet to Gary.
It's part of
they're
their-
still very committed to the hospital, there's no doubt about
I
that.
suspect it was, I just hadn't.
Absolutely, yeah.
Any questions
And
on any?
that, by the way, just so you know, that the brothers and sisters make an annual contribution to the Marks Foundation. It varies how much, but all of them make at least an annual contribution to the Marks Foundation.
Oh, you mean Candy and Judy?
And
And, yeah,
Gary and,
Gary's older brother was much older than I,
Yeah.
can't remember.
can't think of it either. Yeah, Maddie, I can't think of it either, yeah.
So I see a bunch of checks here to employees, I don't look like payroll checks, right?
These would be employee reimbursements
Reimbursements, yeah.
for travel or
Education.
education.
I don't recall seeing mine in
Well,
that's
you-
because
it
it's
wasn't
April.
printed until
May. Mine won't hit till
Yeah,
May.
you'll see,
mine.
you'll see it in May.
Oh, yes, and the world will see it then.
Oh, yeah, that's
Right.
right, I'll make sure, phone's gonna ring.
There's certain certifications we have to reimburse employees for, nurses.
There's a lot of that stuff they can do on the internet.
They don't do a lot of it.
Some stuff.
There's
is
so
a lot
much
of
stuff
it.
that you can, and I didn't know how much the medical field was doing that way or not.
So KOME 95.3,
Mhm.
1485.
Yeah.
Are we advertising?
We'll do some advertising, I'm sure.
Yes, it's for several weeks, I mean, it's like 3 months or 3 or 4 months. We have you heard our ads yet? The doctors?
The doctors are
doing
doing.
Cynthia Daniels has gone over there and done a little blurb, and then Dr. Lossick also, and
Dr. Hutchinson.
Dr. Hutchinson,
Dr. Hutchinson.
It's Friday.
It runs all, for the 2 weeks until the next doctor comes on, but they do
like a
a
health report.
piece on a health report, or whatever that month's health is. Like one was heart. Dr. Davis will be doing men's health in June.
So how are we doing our advertising budget?
We have a marketing budget, $45,000 is what it is for the year, marketing budget.
So that's-
Lisa would love to know exactly what.
We don't tell it.
It's a number of
Public
budget.
information.
She's got lots of ideas. She's enthusiastic, though, I'll give her that.
Sure it is.
But isn't that shared for open positions also? Yeah.
Uh-oh. We paid the Texas Department of Public Safety $25.
That's a, either DME or one of the licensures or
What
physicians.
numbers you have to have.
Yeah,
Biz Pro Tech, 7,700.
yeah, that's computer.
Well, it's not.
I'm gonna tell you they're worth
No,
every
it's
penny.
My question was, what is that for? Because that's
Oh.
he's supposed to be a contractor guy, that's supposed to do it, the IT guy can't figure it out, right?
Yes,
So if we paid him 7,700, he must have done something.
Well, I can pull the business projects bill, I mean, it is pages long, everything from putting up the cameras in the employee parking lots, the cameras throughout the hospital. I mean, it's not just,
Yeah.
Generally
Somebody's
speaking, the
computer's down.
in-house handles the CPSI issues, CPSI computer issues, and then all the sort of the routine, you know, if there's, you know, if an employee's got a problem with a computer, the first call is to Kelly, and he comes up and if it's in my case, you know, I didn't have it turned on right, or booted up properly or something.
I turn it off and turn it back on.
Yeah, so he's doing that, you know, that's his routine, but then all the, I guess, the technical internet stuff and all that, BizProtect does the majority of that. But we've cut that deal considerably with
Well, it looked
I
back.
haven't looked at the year to date, I'm
Yeah.
just looking at the check.
yeah.
We had set up an awful lot of stuff, getting electronic records is where a lot of the
Yeah.
bill came from earlier, didn't it?
Yeah, we're still doing a fair amount of that now with the interfaces and,
Yeah.
you know, now we got, you know, I see 910 is coming up, and that'll be it's another go-round of technical upgrades.
Well, do we have cameras in the parking lot that you can watch on your network here?
We have them in the hallways, and there's some on the outside. The answer to that's yes. Yeah.
Good.
We-
I would have to think of him on the outside if he could find a way to feed that, so the sheriff's department could look at it when at 2 o'clock in the morning, they get a call from the hospital about that strange person out in the parking lot. The dispatcher could look at that strange person, and
Well, we do that or not.
I don't know if he can or not, but he might.
We can pull it up, and we can go back and,
Technically,
you
we
know,
could do it.
and look at history on it. It's, wish we had that when we took our TV.
Well, I've
So
heard a
I
few.
watched Tom Leslie, they picked it up all.
That's right, yeah.
It's too bad that wasn't pointed at, was it Best Value that those thieves went through the skylights or something?
Oh, yeah, across the
Just
street.
across the
When
street.
did they do that?
Just
Last weekend.
last week or
Last
so?
weekend,
Oh,
maybe last Friday night.
they've been
No, Friday
broke into
before.
a long time.
I didn't know that.
Yeah, sure did.
I had my brain.
But they did,
Now we know who's been like.
they did get them on camera, because they came from, Burger King, parked the car at Burger King, came across, so I don't know what's happened with that, but they did have some, some pictures of them they picked up.
Weird, that's so weird, through the skylights. Apparently, it wasn't the first time they've done that. Sorry.
Yeah, I haven't heard about being robbed in forever. I had a picture of the fellow that did it the first time, but that was years ago. He bought his gloves from me and stared right at my camera. I took a real good
So
image of
they
it.
got it? They
No.
arrested him? Oh.
They never did find, didn't look for him, they didn't care.
Yeah.
But
Gloves from him.
I printed him a picture and gave him a disc with the picture on it, so they could at least know who it was. I think we're doing better now, law enforcement wise, I hope. I like to think that, I'm optimistic.
We caught our burglar by accident, remember? Because he tried to sell it to Buck's neighbor, Buck's cousin.
It's been, when I was over with Steve a long time ago, came always one day and it had been broken into and, you know, gone to the desk and gone through it, all that kind of stuff. And the police department right across the street, and he came over there and he said, let me see your patient register. So I showed him a patient register. He looked at the name and he said, let's go up there. Yeah, we went up that patient's room. And, I had a pen, he had a pen in his pocket, and all my stuff was right there. But the policeman recognized him that he was.
I don't even know.
Oh my
Holy
God.
Yeah, they're not real smart sometimes.
Wow. Goodness.
Jeez.
So we harbor criminals.
Yeah, that's right.
On this
Probably was another
discharge,
day too,
on this discharge thing, it shows, I think that's 5, but that's not included in the revenue, right? He had 5, but those 5 are not included in the revenue chart.
Oh.
It was 5 total so far this year, so some will be included, like
yeah.
February and March.
Medicare would not be, but any other payer.
Okay, that was my question.
Yeah, right.
And I didn't realize, I I had my own note. I guess I made copies of my notes. Sorry about that.
All
but-
right, we love that.
Yeah, right? But I was trying to find out because on this statistic sheet, where we have it broken down by the doctors, I was trying to make sure that Barrett had been moved over to under CARP instead of Turk. And then come to find out, I think Kelly said we will be including in the future, but we weren't the nurse practitioners. So Barrett wasn't on there at all.
Well, isn't this just hospital stuff though?
Mm-hmm.
I mean, there's not too
But-
much billing that the nurse practitioners do.
Not too much, but apparently she, a lot of ancillary, and Liz ran like an ad hoc report for me. It was over $19,000 in April.
But those aren't including ancillary fees on this report.
What is that? So what does this include?
I thought that was just what we billed for
Inpatient.
inpatient
Oh,
care.
inpatient. Oh, okay.
That's what this started out as, yeah.
Yeah.
Because, I mean, you look at ancillary, we bill them over $1 million
Oh, yeah,
per
oh,
hour.
yeah.
Well, so what was so what? I guess I'm confused.
Oh, no, it's your note, you tell us what was there for.
Well, no, I'm just saying, well, it's been on there
Well,
way
this-
before me.
Well, this report doesn't interface with financials, it's not, it's a different
Yeah.
report,
Oh.
It doesn't
This looks
interface.
CPSI-ish.
Yeah,
CSI,
it's,
POS.
Yeah.
So the gross revenue page, when it comes to net gain or loss, that's how much more or less than before summertime, or how does that work?
where are you at?
Back page
Charges on this.
versus net
Net
gain.
gain, yeah. That's how much we actually get.
Oh, yeah,
Those
that's,
charges.
there's a formula that we use to go from gross to trying to convert that to what we make profit. You know, we take the contractuals out, and then we take a percentage out for expense, and that's just, you know, trying to estimate for that month, you know, how much money we made
On each employee.
yeah, from each
For each
position.
doctor.
Provider, all employees.
On
I
the-
just noticed on November, Dr. Peters made 14 cents.
Yeah.
But that's all right, because in December, Dr. Turk lost nearly $2,000.
It's, the contractuals come into play here, that's
So
what
that's for a lot, you lost 30,000 in February. So I thought it had to be something strange there, but I wasn't sure.
On the patient statistical report, you can see the admissions, which we've already discussed for April, being 43. Total surgeries, 76, which was the highest month yet we've had for surgeries, down at the bottom of that page. And the total ER visits for April were 669. So that was up.
which is the one,
I wish it was back at 800, because that's when that in-care bill drops. That's- okay.
Any idea about why it seems like we have more ER transfers with less ER visits? Well, averaging less ER visits.
Does it mirror, do we have a high debt equity ratio here? The 195%. And so if we expanded operations somewhere else, that number's gonna go up, right?
the numbers.
Depends on
Where you
The
at?
how
debt
much
equities,
revenue it includes.
the debt equities is 195%, the benchmark's 120. I'm just saying, if we went into debt to build something else, that number's gonna go up,
Yeah, well, yeah.
above 200%.
Yeah, yeah, you're right.
unless y'all have any questions, I think that's all I have anyway.
Well, the other item on the agenda is we talked, and again, it's on the board agenda. We talked back when we did our budget in terms of, historically, we've done a salary increase in June for the employees, and this year we said, hey, you got to earn it because it's not budgeted. I guess from our perspective, what the employees have done with, on the expense side, certainly merits it, because, you look at some of the hospital, we're $444,000 under budget on total operating expenses, and then with the 501A, we're $222,000 under budget. When we look at consolidated, we're over $600,000 under budget for the expense compared to budget. So from our perspective, I guess we think that the employees have earned it.
Good.
Yeah, so what we do on this is, normally we would have budgeted would have been 2%, and that would be for each department would get 2%, and they can allocate that based on the evaluation. So not everybody would get a 2%. There might be some that wouldn't get anything, but it would be based on the evaluations by the department managers of their employees. Some might get 1, some might get 3, some might get none. Now, to qualify for that,
So the 2% will be 2% of the payroll of the department?
yes,
Okay.
yes. If you were hired after January the 1st, you're not eligible for it.
Okay.
If you were hired between October 1 and January 1, it would be prorated. So if you were hired at the end of the first quarter and you would have got a 2% salary increase, you'd only get 45% of that. Yeah, if you're hired December 31st, if you're hired December the 31st, and you're at 2%, you'd get a 1% because you'd only work 6 months during that fiscal year. So it'd be prorated based on the number of months that you worked in that fiscal year as a percentage of what you would have received. And that'd be our proposal on that.
That sounds like a good way to do it.
Well, I think, we asked from our
It's
perspective.
basically the promise that's caused everybody to do some good, isn't it?
Well, I have to tell you, I think that does have something to do with it. I think the employees, heard what we said and responded to that. Any other business that?
Have we thought any more about sending emails out for the last week of the month? How many more ER visits we need to get people to rush in
Oh.
to help our financials?
Whenever you're ready. Motion to adjourn, 6:24.
Are you finished? Are you finished?
Yes, sir, let's adjourn.
I'll move that we adjourn.
Okay, there we
I
go.
want the chocolate coffee.
All right, second by Burrows, all in
Yes,
favor?
we all agree.
All right,
Woo-hoo,
all right.
That's something.
what a team.
6:24, thank you very much.
I'm gonna go to lunch.